I'm going to be doing a CVC dressing change. First thing I do before entering the room is I will do hand hygiene. And then as I enter, I will address the patient. Hi Pat, how are you doing? My name is Connor. I'm a Wilson nursing student. I'm here to change your central line dressing, so your shoulder one here. Is it causing you any trouble at all? Do you feel any pain or any tingling along with it? No? It's good. I'll come in, I'll raise the bed. This is going to take about 6 minutes. I guess while I'm down here, I can inspect the site for redness, swelling. I can palpate for edema. I can look for signs of phlebitis or other signs of irritation, discharge, anything like that. But the site looks good. No migration, which is also good. I suppose at this point I can also check both the patient's identifiers, so name and birthday, allergies, and double check the date on the dressing to make sure that this is the right time to change it, so which would be 24 hours after insertion or every 7 days unless it's soiled. So, having done all that, I can go and prepare my sterile field. I would wipe this down with a reset wipe, which I don't think we have right now. And I'm going to put on some gloves at this point. I don't think we technically have to, but let's get about it. Pivot. This out.
Yeah, because it's moving.
Okay.
Why don't you start recording and then I'll call you?
Okay.
Okay.
Having set all that up, I'm going to start removing the dressing. So taking care not to pull on the actual tubing, I will brace it with my finger and then slowly pull, well, as soon as I can, given it's made of plastic. These are the way. I'll double check that all the clamps are closed. Nothing's up with this end of the tubing. Looks good. Get this off. Pat, you let me know if this is hurting at all, or if it's pulling or sore or anything like that, okay? I suppose this isn't a bad time to also check to see if there's any irritation due to the actual dressing itself, along with the tubing. I also don't have a garbage garbage bag anymore, so I'll be putting all this into a garbage bag, where I have one. So, lifting slowly, pulling. Trying not to get too much shear with the skin. Easier on a real person, but here we are.
I don't know either, honestly.
Pulling out to kind of stretch it out. All the while maintaining the brace on the site. That feeling okay? Not too bad? Good. Okay. Bundle that up and then revisit that in just a moment with these guys, just to finish the job. Here we are. Okay. I'll get rid of this as well. Now that the dressing's off, it's time to change the gloves. So from clean to sterile. So I'm going to wash my hands again. And then I will prep a few things, including getting on sterile gloves before I clean the site.
Yeah, I'm ready.
Okay. hand. I have a chlorhexidine swab for cleaning. I have my tape measure for measuring migration. And of course I have my gloves. So using sterile technique.
If it needs to be changed, like the order to the chart. So,
That out. Garbage.
Okay, wait, let's start again. I need to go over this. Right, the care plan. That's what was not in my mind. Okay, we'll do the care plan. And then,
That.
you get so nervous.
Okay. This can wait.
Okay. So today we're going to be doing a CVAD change.
And I think I'll wash my hands before putting the actual sterile gloves on too one more time. Just handling things.
Change in the measurement of the external segment there. Then I would come into the room, do some hand.
Good hand hygiene.
Thank you.
And then.
At this point also I will ask the patient to turn their head. So the side doesn't turn much, but okay. These gloves are tight on me in the best of times, so we're going to see how this goes.
Continue to look at the site and assess the site. So notice if there's any remnants or swelling, or if there's any discharge there at all. And then I'm going to measure the external segment. So I'm going to get my.
You really need to make size 9 gloves at most cases.
Wow, like a pro.
What a pro. I might as well also keep this open just for an additional sterile field. Although there's a bit of a line in the middle, so whatever. At this point now I can reach into my sterile field with my gloves, so I can reach in and grab the chlorhexidine wipe. I'm going to, well, not touch that I guess. So I just contaminated this glove here. But we'll keep going. Normally I would trade out my gloves. So avoiding the temptation to pick and move things up. Give it a good scrub. Using a back and forth motion. And then we're gonna let it dry. And the importance of letting it dry is both in terms of adhesion of the tegaderm at the end of this, as well as to avoid irritation of the skin. So give that a moment. And then get this ready. It's gonna take a minute or two, but I suppose as this is a mannequin, we can push it a little bit. So we'll say it's dry now. So I'm going to begin to place the tegaderm, making sure that the entire site of entry is going to be visible through the window, and that the tubing comes out through this little notch in the tegaderm. So just like that. Doing great, Pat. Okay. Now at this point, with the insertion site fully covered, I can break sterility because we're covered. So I can just adjust this a little bit, and then I'm going to take off my gloves and switch back to clean gloves for the end bit. Again, I don't know if you have to do this part. It's just personal preference. I hear from instructors that they start to feel kind of invincible when they have sterile gloves on. They can touch whatever they want to, which means a lot of crap can get built up on them. So the little shorter time I have with these on. And ordinarily we throw these out. I'm going to have to reuse these, so I'm going to put them off to the side. way things are going with PPE, we might all have to start reusing these before too long. Pop the lid. Okay, hand hygiene again. I'll put on. Actually, I don't need to do this for this. Okay. Okay. So, take this bit off. Oh, let's get this down first, I guess. You need this, but it doesn't have to stay sterile, so you can put it there. Just secure it around, nice and flat, so it doesn't bother the patient. And then this guy, goes here to just finish securing the catheters in place. There we are. Now it's pretty well secured. Just one more step, but I will just step back to my table for a moment. So this is garbage. With the pen that I definitely have, I would write the date of the dressing change on here. And then turn the bedside, and just one more time over the kind of junction here where the tubing comes out. Just to reinforce it one more time, you place that, again with the date of the dressing change written on it.